We're here today to do a pre-education for knee class. Today's class, I will do the nursing portion of it. There will be somebody from physical therapy. I think Paul's coming to do physical and occupational therapy. Somebody from discharge planning will talk a little bit about going home versus going to rehab. Andy from respiratory is going to come and talk about using an ascending barometer and the importance of coughing and deep breathing after surgery. Val from next door at Terrace View will talk a little bit about subacute rehab. At this point in time, your doctor probably has talked to you about the need for rehab, though. A lot of knees do go home, but usually your doctor has a pretty good idea at this point. Home care. Kathy from the Visiting Nurses Association will come and talk a little bit about going home with the VNA for home care. And then at the patient experience patient portal, we don't have them here. What we've done is we put the email address on the sign-in sheet now. Your email address will be used by someone from our patient experience department. They will send you an email to invite you to our patient portal. Patient portal at ECMC would give you real-time access to any of your medical records from when you're here in the hospital. Okay? Did you sign in though?
Okay. Person.
Oh, you guys are with. Okay, I didn't realize. Sorry. So inside of your packet, there is some information for Meals on Wheels. Some people need just a little bit of help. There is a book on the knee replacement. There's a healthcare proxy form. We encourage every patient that comes into the hospital to have a healthcare proxy. If you do have one at home, bring us in a copy of it or bring us in yours, and we will make a copy and give it back to you. Your signature on your proxy has to be witnessed by 2 people, not yourself or your proxy. So you can bring it in unsigned the morning of your surgery to room 160, and 2 staff members will witness your signature. There's a list of rehab facilities across Western New York in there too. Like I said, a lot of knees go home. It's not a bad idea though to have a plan B. If you weren't able to go home safely, it's all about safety. If you weren't able to go home safely, you could have a plan B set in place. And Val, like I said, from Terrace View will talk a little bit more about that too. Then there's a little survey, if you don't mind just taking a few seconds to fill it out when we're done. On page 6 of the booklet, there's some general information on visiting hours, telephone, TV, cafeteria. Visiting hours we're kind of lax with. We don't care. We most of the time your comfort level's with your family. So we want you to be comfortable. We also encourage family to be around too. When you go down to the therapy gym and you work with the physical and occupational therapist, we like your family to be here so that they can see what exercises you're doing to be able to assist you at home and say, oh, you're doing that right, or no, I think she said we should do it like this. So it's not a bad idea for your family to be around for therapy sessions. You will go to the therapy gym 2 times a day. You'll work with physical therapy and occupational therapy 1 time a day. There is no charge for telephone or TV. Most people bring their cell phone. That's absolutely fine. For families' benefit, there's a full-service cafeteria on the 2nd floor. And there's like 6 or 8 different stations, all different kinds of food in the cafeteria. And then there's the ground floor, Mighty Taco and Subway and Tim Hortons. So your pre-op testing is probably happening today, either before or after this class. It's done in room 160. 160 is actually the surgical waiting room, so it's where you start the morning of your surgery also. There is a list of medications in your booklet that need to be stopped before surgery. They include any aspirin or aspirin product. A lot of us take that 81 milligram aspirin every day. That has to be stopped a week before surgery. Motrin, Advil, ibuprofen, if that's what you're using for pain, that has to be discontinued also a week before surgery. Some over-the-counter fish oils, multivitamins, and if anyone's on a blood thinner, Coumadin or Plavix or Eliquis, that also has to be stopped before surgery. We'll get you restarted on them as per the doctor's orders post-op. If your plan's going to be to go home, just make sure that you got someone at home that's at least going to be checking up on you. You really don't have to have somebody with you 24/7. Just make sure that you got someone that's going to be there to check up on you, help you with meal prep and things like that. You want to try to eat as healthy as possible after surgery. Make sure you're getting the appropriate amounts of fruits and vegetables, proteins, grains, along with an adequate iron supply from red meats, fortified cereals, green leafy vegetables. There's potential for blood loss is there during surgery, so we want to make sure that you're that we're rebuilding those red blood cells. You want to bring this book to the hospital with you, along with comfortable walking shoes. Hopefully we won't have to worry about weather, but if you do, you want to make sure that you got comfortable shoes on and safe. Step-in shoes are not good, flip-flops are not good. Make sure sneakers really are the best and the safest thing to have. You want to bring a brush or comb with you, glasses if you have them, dentures and supplies, and any hearing aids. If you use a CPAP or a BiPAP machine, a lot of people like to bring theirs to the hospital with them. We can get it from our respiratory department, but of course, that mask won't be the one that's fitted to your face.
I have a question.
Mm-hmm.
When I've gone before, I don't like to bring it because I don't want all that air going through mine. They just let me have a low dose of oxygen.
As long as you do okay with that, that's absolutely fine. And if we felt that you needed more, they would call respiratory.
Okay.
Yep, that's fine. And as long as you know that that's what's worked for you before.
Right.
Please do not bring any of your home medications with you. We'll administer everything that you take at home that the doctors want you to continue taking. We have toothbrush, toothpaste, shampoo, body soap. It's not necessary to bring these items with you. If there is something that you'd like to use special, by all means, you can bring it with you. The morning of your surgery, you're going to take whatever medications you've been instructed to take with just a little sip of water. You're not going to take any diabetic medications that morning of surgery. Again, those are the things that they're going to go over with you when you do your pre-ops and also when you see your primary physician for your medical clearance. If you are diabetic, we're going to test your finger sticks 4 times a day. A lot of diabetics that are non-insulin dependent don't routinely check their finger stick 4 times a day before each meal and at bedtime, but we will do that when you're here. We want to make sure that we're keeping your blood glucose levels within normal range. You're not going to eat or drink anything after midnight the day before surgery. You're going to get 2 different times from your physician, your time of arrival and your time of surgery. You want to make sure that we want to make sure that you're here and all the preparation is done before your surgery time. You may not get that time until a day or 2 before surgery. That's kind of routine with some of the doctors. So just make sure that if you haven't heard from them, the morning before your surgery, that you give the office a call. If your surgery's on Monday, you can call them Friday and just find out if you have not heard from them with your time. Your family's going to be given an ID number to follow your progress on a big screen TV that's in the waiting room, down in room 160. They will take the patient in the back, get you in a gown, and then normally let your family come back in with you. They call it minimal separation. They want you to be comfortable. You will meet your surgical nurse and the anesthesiologist. Then the surgeon's going to come. He's going to confirm with you what he's doing, a left knee, a right knee. Is anyone having bilateral? Okay. That does happen sometimes. So the doctor will take a Sharpie and he will label what he's doing. He's the guy that's going to let you know how long surgery is going to be, so more for your family's benefit. Usually a knee is 2 to 3 hours. And we just ask that the family be back in 160 to talk to the doctor after surgery. And then once the patient's ready to be released from the recovery room, the nurse down there will call up here to the nurse that's going to be taking you to give report. Dental prophylactics. You will need to be pre-medicated before going to the dentist. Depending on the surgeon, it could be for a lifetime, for the rest of your life, or it could be just up to 2 years. It really is surgeon dependent. Newer studies show that 2 years is sufficient amount of time. So the reason for this is you go to the dentist, you have your teeth cleaned, even routine cleaning, and you might have a little scrape on your gum, and tomorrow morning you wake up, it's gone. When you have this new joint, any infection that enters your body can settle into this new joint. The amount of bacteria that we have in our mouths, of course, that can happen. So pre-medicated with an antibiotic before you go to the dentist. It's usually amoxicillin unless you have an allergy to it. It is a prescription that you get from your dentist's office. The doctors have asked us to say, though, they do not want you to have any routine dental work done between now and surgery date, and then for up to 6 months after. So your best bet is before you see your dentist the next time you talk to your surgeon's office. Okay, any questions on that at all?
Can I ask a question then about dental?
Mm-hmm.
I had made an appointment with like the diagnosis, I have a callus on a toe that I wanted to have kind of mitigated a little bit before this, so it's not gonna, but I don't know, I mean, he might be scraping a callus. Maybe I should postpone that.
You know what, you might want to, yeah, it's probably not a bad idea.
Yeah, okay.
You don't want to have any kind of open,
Got it.
any kind of open sores on you. So, you wake up the day after surgery, you got this new joint, and we're gonna get you moving. Melina, our therapy aide, will come into your room the next morning. Each one of the rooms has a reclining chair that's on wheels. She will take you down to the therapy gym in the reclining chair. Depending on what time you come up the day of surgery, therapy may be in to work with you, and Paul will talk a little bit more about that. But some of the language that you're going to hear when you're here with us is your call light. We want you to utilize it at any time. We do purposeful rounding here, the hours from 6 in the morning till 10 at night. Someone from the staff is in to see you, but you always have your call light next to you. During night shift, it's every 2 hours. But again, we want you to put on that call light if you need it. Your bed alarm. Every patient that comes to our floor is placed on a bed alarm. We want to, it notifies us, the staff, if you're attempting to get out of bed by yourself. We want to help you. We don't want you doing it on your own. Blood tests, daily labs will be done to check your levels, including your iron level, the hemoglobin. Every so often, someone needs a blood transfusion. There's potential for blood loss during any surgery. It's a little bit higher with an orthopedic surgery, so we do monitor your labs every day when you're with us. Your vital signs, along with your pulse ox, we're going to monitor that. That shows us how much oxygenation you have in your body. Foley catheters we don't see too much of anymore. Foley catheter is a bag, a tube that would be put into your bladder during surgery to collect urine. We don't see too many of these anymore. If you do wake up with a Foley catheter, there will be a standing order to remove it either that night or first thing the next morning. A hemovac is a drain that we used to see a lot of. We don't see too much of it anymore, but sometimes patients will wake up with this after surgery. It's put into the joint space to collect blood and body fluid from around that joint space. The drain is emptied every shift by the nurse taking care of you. The output is monitored. If you do have one of these, the doctors remove it the next morning. It's a very small catheter tip that's closed with just a Band-Aid. Foot pumps, leg pumps, TED stockings. You will wake up with TED stockings on. Most likely, these are to help prevent blood clots. We also will send you home with these if you do have them, with the orders on your discharge instructions. Foot pumps and leg pumps, these hook to a machine that sits at the bottom of your bed, and these also are used to help prevent blood clots. Air is instilled into these to promote circulation. And the Aquacel dressing is a waterproof dressing that the doctors use after surgery, meaning you can shower. So this will be on you after surgery, okay? And again, you can shower, that's a good thing. So while you're here at the hospital, we're gonna give you all of the home medications, your home medications the doctor wants you to continue. We're also gonna be giving you 3 doses of antibiotics. First 2 you get in the recovery room, and the next 2 you get up on the floor. We'll give you some type of an anticoagulant or a blood thinner, and usually what we see is a high-dose aspirin for that, unless you have any kind of history of clots at all. We'll give you Colace or some other kind of stool softener. Pain medication and immobility slows the motility of the bowels down. We don't want you to get constipated. So we'll give you some type of a stool softener. Pain medication, of course, we'll be giving you that. We do purposeful rounding, the hours from 6 in the morning till 10 at night. We kind of talked about that a little bit. Night shift, it's every 2 hours, but just make sure that you're discussing your pain medication with your night shift nurse. Meds to Beds is a new program that we have available here at the hospital that we're trying to utilize. We're piloting it on our floor. What it is, it's the ability for you guys to choose to have whatever one-time prescriptions you might be getting from us. It's usually pain medication that you would be getting from us prescriptions that don't have a refill, so it won't be anything routine. But you do have the ability to have our providers send those prescriptions down to our pharmacy here on the ground floor, Medcare. It's, when those go down, one of their techs, the pharmacy techs, would bring them up to your room, deliver your medications to your room, and collect whatever regular copay that you have due for your prescriptions. And what it does is kind of a convenience so that you don't have to stop at your CVS or Walgreens or whatever on the way home to pick up your prescriptions. Again, it's nothing that is mandatory, it's just an option for convenience for you guys. Miscellaneous, there is no parking fee today. You're going to just drive to the gate today. They're opening up on their own. If not, we do have the ability, I know today it's working that way, but we do have the ability to sign for your card for parking. You're going to get some, yes?
Is that just today, or is that all?
Today it is working like that. It's probably, I'm not sure when it's going to be fixed. It's been down for a little bit. When you drive to the gate, it's just a sensor that opens it. Okay. You're going to get a few business cards today. Please reach out to anybody with any questions that you may have. There's a few other people that are going to be presenting today. So any questions that you might have, you will get a number of business cards. Any questions at all now?
I'm going to go over a little bit about the kind of social work discharge planning role, and then open it up. If you guys have any questions, feel free. Normally therapy goes before me, but I'll kind of go over a little bit about what we do. We work very, very closely with your therapists. We kind of follow your progress while you're here, and then we're going to help you leave the hospital. So we're going to help you get home or to rehab, whatever your goal is. So our therapist will assess you normally right after surgery, and they'll kind of give us an idea if you're on track to go home or if you're going to need to go to rehab. Just a show of hands, how many people are thinking about going to rehab? Okay, all right. So rehab is an option. It's an option for everyone if you qualify. Your therapist determine if you qualify. I'm going to talk a little bit about discharging home first. So if you're on track to discharge home, the therapists notify you, and then we normally set you up with home therapy, and then also whatever therapy is recommending equipment-wise. So normally equipment would be a rolling walker if you don't have one, a commode, possibly a shower seat. We would let you know if those items are covered. Normally the walkers are covered, it's the shower seat and the commode that typically aren't covered, but we will let you know that up front before we order it. And then we set you up with in-home therapy. Is everyone from Erie County here? Yeah, that's good. If you weren't, we would let you know what's available to you from whatever county you're from. So in Erie County, the options for home therapy are Visiting Nurses Association, Macaulay and Home Care, Will Care, Amedisys, and Alpine Health. We have a couple vendors from Visiting Nurses, from Macaulay and from Will Care here that are stationed here. So if you don't have a preference, we typically make a referral to one of those agencies. They meet you here at the hospital before you leave, and then they kind of set you up with a home therapy schedule. Normally the home therapists come out for about 1 to 2 weeks after discharge. They're going to visit you maybe 1 to 3 times a week, depending on how well you're doing. So that'll get you right to your follow-up with your surgeon. At the follow-up with your surgeon, he might say to discontinue the home therapy and start doing outpatient therapy. So that's kind of the process for discharging home. If you were to discharge rehab, you just kind of add rehab into the mix. So you would get therapy here, then go to rehab, then do home therapy, and then follow up with your surgeon, and then outpatient therapy. If you do want to go to rehab, what we recommend you doing, even if you think you're going home, we recommend that you take a look at the rehab list in your packet, and it's called pre-applying somewhere. We kind of equate it to making like a hotel reservation. So you're reserving a room at rehab in the event you should need one. They don't charge you for it. It's a good idea just to have a backup plan in place in the event you do need rehab. So what you would do to pre-apply is you'd kind of review the list. You can ask family members, friends for their opinion. You'd want to call the facility that you're interested in, ask to speak to their admissions team, and then they'll ask you questions about when your surgery is, who your surgeon is, what your insurance is, and then they're going to hold a bed for you. If you get here and we figure out you don't need rehab, we just cancel it for you. You don't have to do anything. They don't charge you for it. So it's a good idea, even if you're thinking about going home, to pre-apply somewhere.
So what determines, you said we decide, what determines if you could just go home or if they think you need the rehab?
So it's largely dependent upon what your surgeon says and what therapy says in their evaluation of you.
So if you're not able to do what they want you to do?
Correct. If they feel you're not safe and not independent enough, then they're going to probably recommend rehab for you. Right, Paul?
Yes.
Paul's from therapy. He'll probably go over a little bit more about what they're looking for. But they're very good. They'll specify goals that are tailored to your house, and if you're not meeting those goals, they're probably going to recommend rehab for you. Are there any questions about discharging home with services, with equipment, or discharging to rehab? Anything you can think of? Yes?
I've read about some kind of a ice chiller or thing they put on your knee. Is that something we go home with? Or?
So that would be a cryo cuff.
And Paul will go over that.
And Paul will touch on that.
Okay.
That'll come up with you from surgery, and you take that right home with you. So we don't have to order that. That's, once you get it, it's yours to take. So, yeah, good question. Anything else? No? What I'll do is I'll leave my card up here, my business card. If you want to take one home with you, if you think of anything when you're at home, give us a call. If we don't know the answer, we'll figure it out for you. So, good luck with surgery, okay?
Thank you.
All right, thanks. Something before you.
All right. Okay. Hello, everybody. My name is Paul Kelleher. I'm one of the physical therapists who works here. Just want to go over what you can expect from physical and occupational therapy the day of surgery and following that, okay? So for those of you who are going to have surgery during the earlier part of the day, you will be seen by physical and occupational therapy the day of surgery, and we'll see you in your room, okay? And when we see you the day of surgery, we don't do a lot. We're going to go over your exercises, and if you feel well, we'll get you up out of bed and have you take a few steps, sit up in the chair. That's about all we do, okay? Now for everyone else, we'll see you the following day, and we'll see you in the physical therapy gym. And Lynn, you're going to give me a tour? Okay. So Lynn will give you a tour, and it's just right down the hallway, okay? And we'll see you twice a day right up until you either go home or go to rehab. You can go home when you can get in and out of bed by yourself, stand by yourself, walk by yourself, go up and down stairs by yourself if you need to, and when your pain is managed. So when that happens, then you can go home. Now, if you're not able to do those things, then you may need to go to rehab, okay? As far as equipment, you don't need to bring any equipment with you. Each room has its own private walker. When we get you up for the first time, we use a walker. And then in the gym, we have all types of equipment. Like Liz told you, any equipment that you may need to go home, we will order that for you, and we'll have it delivered right to your room, okay? If you go to rehab, the rehab facility will order that equipment for you, okay? All right. Good news is that everybody will be able to put as much weight through your operative leg as you can tolerate. So you will not damage your knee by putting weight through your leg. It may hurt, but you will not damage your knee, okay? And we actually want you to put weight through that knee, okay? As far as exercises, if you wouldn't mind opening your book to page 18, please. So these exercises, I want you to circle the ones that I go over because we're not going to be doing all of the exercises in the book. And you are to start these exercises the day of surgery, okay, day of surgery. So for those of you who are not seen by physical therapy the day of surgery, because your surgery is a little later than the day, I want you to start these on your own, okay? Obviously, once you've had something to eat and you're feeling okay, you're waking up from the anesthesia, then go ahead and start those exercises. So do these a few times at home prior to surgery so you're familiar with them, okay? So the first exercise that we're going to do is the ankle pump, and that's just pumping your ankles up and down, okay? And you can do these exercises on both sides if you want to. You don't have to, but you can. The next exercise right below that is a quad set. So with your operative leg straight, all you're doing is you're pushing your knee down, contracting these muscles, okay? You're not bending it, you're just pushing it down like there was a marshmallow underneath your knee and you're trying to smush it. That's it. Okay, so page 19. We're going to skip the one at the top of page 19, and the next one we're going to do is the heel slide. Heel slide is just bending your leg up and down. So while you're lying in bed or you're sitting in a reclined chair, it's just bending that leg up and down, okay? It's very important that you do start bending that knee right away. Obviously, it's all, and just, all of these exercises are done within your tolerance. I don't want you doing these to the point where it's putting tears in your eyes, okay? So all within your tolerance, but it's very important you start moving that knee right away, okay? Turn the page, please. Okay, so we're not going to do any of the exercises on page 20, and we're only going to do the one exercise at the bottom of page 21. Okay, bottom of page 21, and those are the knee slides. So with your foot on the floor, all you're doing is you're sliding your leg forwards and then backwards. So if foot's on the floor, you're not lifting your foot off the floor, you're sliding it forwards and then backwards. That's it. So the knee slides, don't worry about doing those on the day of surgery, okay? On the day of surgery, just do the first 3 that we went over. And as far as the knee slides, we'll worry about those the following day, okay? All right, so do these a few times at home, and then when you do have surgery, if you're not seen by a therapist, start them on your own, okay? Cryo cuff. Okay. It's kind of a fancy cold pack. So everyone's going to get one of these, okay? Now, I'm just going to kind of go over how to use it right now, but we'll explain it to you when you're in the hospital, so by the time you leave the hospital, you will know how to set this up, okay? So you basically just take the top off. There's a line for ice. You put the ice in, then there's a line for water. You put the water in, put this over, and then you just put the top back on, okay? Now, the unit that we're going to give you, it actually has a motor. So you will actually plug this in, okay? Now, as far as, this is the cuff. What you do. So there's a wide part and a narrow part. The wide part goes on the wider part of your leg, like this, okay? Now, there's a little hole there. That's where your kneecap goes, okay? So it doesn't have to be perfectly lined up, just close. So that's where your kneecap goes. And this doesn't have to be real tight, just snug. And then you just attach the lower part, plug it in, and then what it does is it takes ice cold water and it circulates it around your knee. And what's nice too, it also has a compression effect, all right? This is very important that you use this. More you use it, the better. That swelling will cause pain and it will also slow down your healing. So the sooner you get that swelling down, the better you will do.
And if I wear that over clothes, or do you recommend it against?
Well, normally what we recommend is, yes, you can put it over clothes. But if, let's say, you're wearing shorts, what we use is like a pillowcase. That works perfect. Sometimes if your clothes are too thick, you might not feel the cold as much because we want it to get cold. Pillowcase works great. But if you're wearing pants, you can certainly put it over your pants.
So in other words, put the pillowcase over that thing?
No, so you take the pillowcase, you put the pillowcase around your
got
knee,
it, okay.
and then wrap it around your knee. Okay? The more you use this, the better.
Is there a schedule, like 15 minutes on, 15 off?
No, more the better. More the better. Yeah, it's not, typically with cold packs,
Yeah.
15 minutes. No, that's a really good question. I'm happy you asked that. No, more the better. Okay? These things are great. Oh, and when you set this up, don't set it on the floor. Okay? And the reason being is because then the motor has to work against gravity, and it could burn the motor out a little faster. So what we recommend is just like set it up on a chair, or set it up on a table, just so the unit is level with your knee. Okay? All right. Okay, so like Liz told you, for those of you that go directly home, once you go home, you'll have home physical therapy out to the house within 24 to 48 hours. They're going to work with you right up until your follow-up visit with the doctor, which is about 10 days. At that point, your doctor will probably recommend you going to outpatient physical therapy. So that's the general protocol, physical therapy here, home, then outpatient. If you go to rehab, like Liz said, you just throw that in the mix. So therapy here, rehab, home, then outpatient. General protocol, there are exceptions though, okay? Any questions? Okay, great. Well, nice meeting you folks, and we will take good care of you when you come in for your surgery.
Good morning, everyone. I just want to take a few minutes to talk to you about this brilliant device here we're asking you to use called the incentive spirometer. It's basically what it is, it's a visual aid for you to see how much air you can pull into your lungs, okay? So whenever anybody has surgery, especially joint surgery where you're not moving around like you normally would, you're laying in bed for extended period of time, you tend not to take deep breaths. So as you're laying in bed, your lungs actually collapse from the bottom up because you're not taking those deep breaths, you're not moving around, okay? So this is a way that we can prevent that from happening and fix it when it does happen, okay? So basically, what you're going to do is through this mouthpiece right here, nice tight lip seal, take a slow, deep breath in just like you're sucking on a straw, all right? When you do that, you see this blue indicator move up, show you how much air you're pulling into your lungs. You want to pull that thing all the way to the top of your breath as high as you possibly can, all right? Hold it a couple seconds and then release, okay? So what you're doing is you're expanding your lungs, reopening any areas that may have collapsed down. You might do some coughing when you do this, which is a good thing. If not, we want you to do a little forced coughing. Again, just to mobilize anything in your lungs, keeping them as healthy as possible, okay? Everyone's going to be different. Some people will do 1,000, some people will do 3,000. It depends on your age and your sex and your lung history. Were you a smoker? Are you a smoker? Do you have COPD? Do you have asthma? Those kinds of things, okay? So the important part here is to do the best that you can do. Get that as high as you possibly can with that big, deep breath in, all right? Now what will happen is after your procedure, you'll come up to your room. Pretty quickly after that, we'll bring one in for you. We're going to go over it again. We're going to have you do some practice runs. From that point forward, we really want you to do it on your own, all right? Every 1 to 2 hours while you're awake, all right? About 10 breaths, nice slow deep breath, do a little bit of coughing. We're going to come in and we're going to encourage you to do it as well to make sure that you're doing okay. But really the first 24 to 48 hours is the most critical. You want to reopen those lungs after surgery and then keep them open, okay? As you get up and you're doing physical therapy, you don't have to use it quite so much, but that first 2 days, definitely every couple hours, all right? Every 1 to 2 hours, about 10 breaths, okay? Questions for me? All right, thank you.
Hello everyone, I'm Valerie Killian and I'm here to give you information about subacute services so you understand what your need may be after surgery. First and foremost, you should go home. You should go home because that is where you will recuperate the best and that is where you will feel the best. However, there are many reasons why you shouldn't even go home. And some of them are the basics of, if you can't get up and off a chair on your own, up and off of a bed on your own, or with a device, meaning a cane or a walker or another person, you can't get into the bathroom in and out by yourself, up and off the toilet on your own, and or in and out of your kitchen to do simple meal preparation, you should consider subacute. Subacute is free choice. No one should tell you where you should go. However, I'm here to be your resource to give you some ideas of to think about. Number one, don't go anyplace blind. You're going to be post-anesthesia. You don't want to go walk into a place that you thought was the Hilton, and it's a rehab facility meant for your rehabilitation. And your thought process of what it might look like and be could be different than what it actually is. So make sure you go and visit unannounced ahead of time so you can see really what the situation is. Make sure that if you want a private room, they have all private rooms to give to you. Otherwise, how can someone promise you a private room? Make sure that you are on a unit that's all orthopedic. You're having your knees replaced or your hips replaced, and you want to make sure you are on an orthopedic only unit that is infection free, because you have new joints. You don't want to be around any infections that could possibly penetrate your new surgical site, and you want to be very, very careful. Make sure that you have a gym that possibly is separated, not just by a curtain or across the way, that you're with like patients, that you are rehabbing with other people like yourselves. Make sure that you're going to get therapy 6-7 days a week, sometimes twice a day. These are the questions you want to be asking when you go and have your post-surgical plan. Don't do the surgery without a plan. Meaning, who's going to be there for me at my house, or which rehab facility am I going to? Who's going to cook my meals or bring my meals, or what am I cooking ahead of time to freeze, or what subacute am I going to, and did I look at their menu? All right, so it's as simple as that. You want to make sure that you understand your location and your accessibility. We here have a subacute on the campus called Terrace View. It is the long-term care facility. However, we have approximately 6 units that are truly long-term, and the rest are all subacute services or short-term stay. We have 17. We have 400 beds. Hospital is 600. Combined, we are a 1,000-bed campus, and we're a level 1 trauma center, so we're pretty busy. So please, if that is the thought that you'd like to stay on a hospital campus where you've had your surgery, make sure that you even call us ahead of time, because we never know what we're going to get because of all the traumas that come through and all our orthopedic traumas. I think that's it. My biggest point is that if you are looking at subacute, no one should have you sit down and fill out hours worth of paperwork. They really just need to know your name, your date of birth, the type of surgery you're having, where you're having it, the date, and your insurance company. They don't even need to know the policy number. They need to know that you have the insurance, what the company is, and to make sure that we have or they have your insurance company's contract. And that's pretty much how it works. Don't do anything blind though. Remember, you've just had surgery. I'm not sure about you, but I don't feel so hot right after surgeries. And I think you should know what you're getting yourself into. Terrace View does have an all orthopedic, non-infectious unit that is only orthopedic. We have a gym that is separated by a hallway. You are only with like patients. We have all private rooms with all private bathrooms, with all private showers within those private bathrooms. 22 showers. My housekeepers love it. So, why? We're a brand new facility. We're the newest facility in Western New York. So that's why we have what we can accommodate for you. We also have a bariatric unit, a ventilator unit, men's behavioral health, 2 Alzheimer's units, lockdown units for memory care. We have orthopedic subacute. We also have cardiac, neuro, you name it, general surge, trauma, we have it. So I'm going to give you my card, because if you need more information about subacute services, you can call me. I will be your information for you. When you go to subacute, make sure you dress and bring appropriate clothing. No skirts, no tight jeans. Things that can be layered in case you get warm in the gym, because you will be working out. And that goes no matter where you go. All right? So I'll give you my card, and I wish you all well. You're in great hands. General surge, trauma, we have it. So I'm going to give you my card, because if you need more information about subacute services, you can call me. I will be your information for you. When you go to subacute, make sure you dress and bring appropriate clothing. No skirts, no tight jeans. Things that can be layered in case you get warm in the gym, because you will be working out. And that goes no matter where you go. All right? So I'll give you my card, and I wish you all well. You're in great hands.
Hello.
Good luck to you.
Good morning, ladies and gentlemen. I'm Kathy with the Visiting Nurses. If you don't go to Subacute Rehab, we would love to have you part of our team. I represent, like I said, the Visiting Nurses. I'm the liaison here on site. So I work very closely from behind the scenes with discharge planning. If you do choose our agency for a period of a couple of weeks until you go for your follow-up, and then at that point in time, you'll reassess with your surgeon. We service all of Western New York, and we take most every insurance you could think of. If a funny one comes along, we'll be glad to do an insurance check, and then we'll take it from there. Very smooth transition. We are a 4.5-star agency. We take pride in that. Always striving to be number 5, so we would love to have you on our team. We'll take really good care of you. Any questions or concerns?
So when does one sign up for whatever agency? Just before discharge, or can you do it in advance? Or?
Usually, yes. The discharge planner will come to your room and then you guys will discuss it at that point in time, okay? That's for you. Are you together?
Yes.
This is just some information. Here you go. Together? All right.
Thanks, Kim.
Yeah, you're welcome. Just one over here.
Just one.
Okay, you guys are together? Okay.
All right, thank you.
Yes.
Okay, that concludes the class. There is a little survey, if you don't mind taking a second to fill that out. Does anybody have any questions at all?
I thought you were gonna show us the whole deal.
No, you can YouTube that.
So, coming into the hospital, should I be wearing sweatpants or should I?
Sweatpants is not a bad idea. You want to make sure that you don't have anything that's going to be too constricting on the knee. Depending on the weather, shorts, capris are fine. Sweatpants is a good idea. Something
Sneakers,
that's
you
going to be able
recommend
to go
sneakers?
over, yes, and sneakers. Something that's going to be able to go over that dressing. Most people, what they come in with the day of surgery, go home with. That's what they wear home when they leave here, and that's fine.
So actually, what you come in with, your family takes home and then brings back.
Hey, you can leave it here.
Oh,
Doesn't matter. Some people bring clothes with them to the hospital, pajamas, that kind of stuff. You don't have to. I mean, most people just have the hospital gown on there. And that's fine. Whatever's going to make you comfortable. Okay?
How many days do you usually stay?
Good question. And me is overnight, usually 2 nights.
2 weeks, okay.
Yes. Some people do go home in one. They do very well. When I come in the morning, they might be standing at the desk waiting for therapy because they want to go home. Some people need a 3rd night. So, our average is 2 though. Okay. Any other questions you guys may have? You've got a few different business cards today. Again, please don't hesitate to use them. On the front of your envelope is either my card or my nurse manager Renee's. Please don't hesitate to use either one of them. If you do have any questions when you get home that you didn't think of or that you just want to confirm something that you heard.
So she's talking about the subacute. I mean, if I wanted to go look at tear tube, we can just go over there and
Absolutely.
walk right in.
Yes.
Okay.
And you're more than welcome to do that. You're probably better off driving down there just because of the weather and, just pull out of this lot and pull in down there. Okay? Alrighty, thank you.